My journey in our industry began at the front desk of a doctor's office. I became a biller and years later founded a medical billing company. After selling my business in 2015, I've turned my attention to sharing what I've learned with others. This is Leaders in Medical Billing, and I am Khani Gluck. Together, we'll learn from leaders in our industry, explore challenges, and discover specific takeaways that you can use in your business. This show is sponsored by 4D Global, empowering medical billing companies to grow through offshore staffing. On today's episode, I'm talking to Abdul Ahmed, the CEO and co-founder of CA Billing. And what I find remarkable about this conversation is at such a young age, he has started a company, but he's also helped 7 other young entrepreneurs start their own company, many of which started off working for him and have now opened their own businesses. And he has such a great attitude about it because he's such a kind and giving person that he feels like there's plenty of business for everyone. He has an abundant mindset and he truly, truly wants to help people. And that really comes out in this episode. So I hope you enjoy this episode as much as I did talking to Abdul. And if you enjoyed this episode, please share it with your friends. I am excited to have my friend Abdul Ahmed on our podcast today. He is certainly a leader in medical billing. He is the CEO and founder of CA Billing. He developed and implemented an in-house billing system at a large behavioral health facility before co-founding CA Billing in 2016. Tell us how you got started, Abdul, and take us back to when you started this company, and even before. Like, how did you become this entrepreneur at such a young age?
Well, first and foremost, thank you so much for having me on. I'm super grateful for this opportunity. Yeah, I was just kind of thrown into this industry, to be honest with you. I worked for a program down here in Orange County, just working operations, nothing special about it. And our owner at the time was having certain challenges with the third-party billing company that we were utilizing. Just very basic, lack of follow-up, lack of attention to detail, just the basic reasons why someone considers either switching billing companies or bringing it in-house. And for me at the time, I just fell into a really short window of this opportunity of being able to start this billing department, having no real knowledge of insurance at all. And just getting really good at the items that the other billing company fell short on, which is follow up, being aggressive with insurance companies, making sure that we could collect every penny, no matter how large, how small, it didn't matter. Making sure AR was manageable at all times. And I just got really good at it. I had a great team. My partner, Cody Parks, who's still with me today, we learned together. We built an amazing billing department for that company, and soon after ventured off and started CA Billing about a year and a half after doing that. And I don't know, that's I always think about that question, like, how did I become an entrepreneur, right? I guess it's just that drive that I had that I didn't know I had. Definitely growing up, I didn't have any aspirations on being an entrepreneur, and especially being where I'm at now with family, the kids, businesses, all of these cool things that have happened. It's just this growth that naturally just kept happening. Putting one foot in front of the other, and just wanting more, never being settled with the results. And I guess that's really what medical billing is too, because there's just always more. You can always learn more. You can always be doing more. You can always be collecting more, and they're always releasing new and fun guidelines for us.
So tell me how that conversation started between you and Cody. I'm assuming you guys had some conversation, like, let's start this. What prompted you guys, and what are each one of your strengths? Like, because when you decide to go into partnership, right, you each have the strength you bring to the table. So talk me through that conversation. How did that go?
Yeah, it was actually a very interesting position that we were in. We had been offered to take over doing some billing for a provider that was pretty close to us. And, he gave us this opportunity. And at first we were like, no, it's, we can help consult for you, kind of give you the traits of whatever's needed. And he's like, no, man, I need more than that. He's like, I need you guys' full help. And we talked it over, and it was kind of just something again that we just kind of got thrown into. It was just opportunity that was just kind of handed to us, right? We were like, okay, why not? So we formed this company, literally not thinking it's going to turn into anything crazy. Uh, and after a couple of months, we got another referral for another client, and it just literally just grew into something that we had no idea about, right? And realistically, why me and Cody work so well together. And you're right. It's we all complement each other for sure. I'm more or less on the client facing side, client relationships, business development, marketing, working with employees. Cody's really, really, really good with the operations side of it, making sure that, we're using the most up to date coding, making sure that we're working with the right third party negotiators, getting the contracts, all of that stuff. He does really well with that portion of it. So, again, we complement each other very well on all aspects of the business.
That's a beautiful thing because you see so many partnerships go bad, and it's just so cool to see how you each are operating in your own zone. So
Mm.
talk to me about, I know things are going really great for you guys and you are just killing it. Tell me something that keeps you up at night, or what are some of the things that you worry about?
Yeah, that's actually a really good question and got me thinking. For me, honestly, it's the things that keep me up at night is you know, missing any sort of detailed item that we need, right? Whether it's missing authorizations, getting denials, these peer reviews sometimes, where we're like, come on, we believe that this client meets this level of care. We know he does actually, or he or she, whoever the case may be. And those are the things that keep me up at night, just because it's so frustrating to know and believe that we're right, but we just can't portray that same story and message to the insurance companies. So it's a give and take, and for me, that's a loss. It really is, and I take that seriously, just because like when you're reading these charts and you're seeing all of these things that are going on, and you want to be able to protect these patients, right? Because that's what we're doing. No one really knows who we are, but we're working behind the scenes to make sure that they can get the treatment that they need. That's the kind of stuff that keeps me up at night. It's like, okay, what lesson did I learn from this today? How can I make this better tomorrow for the next patient? Not that it happens too often, but I take my job very seriously, and I do take my work home with me, so I feel it.
No, and I know you deal with, mostly addiction, right? And so that is a serious problem in the US right now. And it's so amazing to see how passionate you are about helping these patients. And you are the silent hero in all of this, right? Making sure that this stuff gets paid and they can get the treatment they need. Tell me about where do you see the industry going specifically in your space, right? You're in a very niche area in medical billing. It's, substance abuse and detox, and we could talk more about that. But where do you see that industry going?
Yeah, honestly, that's the most frequent question I get, to be quite honest, from a lot of different providers, clients, and all of that. It's like, okay, like where do we see this going? We saw when I first entered this industry back in 2014, high reimbursement rates for all payers across the board, and we've slowly seen them go down. And not that they've gone down to the point where we don't really see a resolution to growth or reimbursements, just to be able to have a baseline where the providers can still run their businesses. But we definitely have seen changes, and it's gotten tougher. Where do I see it going? I see a lot more programs utilizing new items like telehealth. I see it going to more or less a in-network model. Not that out of network is so much out of play by any means, but we have been seeing a lot more contracts being signed by our providers, getting forth from the payers themselves. And yeah, I mean, it's not going anywhere. Addiction and mental health is not going anywhere. I'll tell you that much. If anything, we saw a huge skyrocket, from 2020 to where it's at now. But realistically, knowing that patients can receive the care that they need, utilizing telehealth programs is huge, because of the fact that they can do this safely at the comfort of their own home. And even if they leave at, a residential facility, they can go back to, if they have 30 days that they leave, they can go back home and continue their treatment that they need.
Very cool. And so you're seeing that there's more in-network coverage, right? So insurance
Mhm.
companies, where before they didn't want to cover these services, you're seeing the insurance companies wanting to cover it more now.
Oh yeah, yeah. We've seen a lot of changes on that side of it. We're seeing them gladly actually offer these services now, rather than before them saying no, never. We're now seeing being like, okay, yeah, sure. So that's a huge change and a huge win for us.
Major progress. Wow, that's really good to hear. Okay, so you're growing really fast. Your business is just doing amazing. And I know you're hiring a lot. What is your take on offshoring, like leveraging the global economy?
For us here at CA Billing, for me personally, I love it. Right, I'm really big into culture. Culture is everything to me. Making sure that my employees are happy, making sure that my employees can have the tools that they need to be able to accomplish the works that they have in front of them. Because a lot of them think just like us, right? They take this stuff home with them, right? And we've seen that same passion from offshoring with our beautiful company that we work with, right? And it's really just that synergies between the two and making sure that they can have the right amount of input, be on the same page with everything. And that's exactly what we receive. So for me personally, I love it. Again, it's all about culture. It's all about making sure that the people that we're working with are happy. And again, that they have everything that they need to complete the job.
That's great. Wow, good to hear that. So, what's next? Like, what are some of your big goals? Because you started your company, how old were you when you started?
I was 25, 24, 24.
Wild. Okay. And so that's how old I was when I started my company, and I was just like flying by the seat of my pants for many years there. But you seem to be super grounded, very focused.
Yeah.
So what's next for you?
Just continue building. That's it. That's my high. I don't really have any high aspirations of get into a size where it's unmanageable. I love what I do. Like I said, I like being able to have a good touch and feel of everything that's going on, talking to the employees, talking to my clients, being a part of the whole process. But yeah, just continue building. We're implementing a lot of cool tech here, to be able to help our us grow and also our clients as well. So it's really just staying with the industry itself, and we're seeing a lot more technology-based systems, which is awesome. So making sure that we can be innovative, first to market with certain things, and making sure that our clients again have the tools that they need to grow. Right. So we've seen a huge shift in that from where we started to where we're at now. Before it was just kind of like you're just tossing Hail Marys and seeing what you can receive. Now it's all data driven, right? And that's what we need to make sure we have is the data.
Okay. Do you want to share with us what cool technology you're working on? Or is it like
Yeah.
top secret information?
No, no, no. We can definitely talk about it. So yeah, no, we have certain analytic portals that we're creating to be able to help our clients grow. Meaning, reimbursement factors where they can see exactly what they're going to be reimbursed before the client even admits. That's something that we've been utilizing for a lot of years, but taking it on a more granular scale, and releasing that forward-facing portal. That's one part of it, and then reporting as well. Being able to type in certain demographic information, policy information into our database, where it'll basically tell you, for a 30-day, 60-day, 90-day stay, exactly how much you'll receive by plugging in not only the policy information, but the deductible and out of pocket, and giving you that information readily available. So those are the couple snippets that we are going to be releasing soon, and the rest will be making some announcements.
That's awesome. So how often do these rates change? Do you have to continue to work on this every year, or how often are you looking at these? Because I think it's an amazing that value
Mhm.
add to any organization to know exactly what they're going to get paid to see if it's even worth it to admit a patient. How often are you having to update these numbers?
Oh, for us, they're updated daily. And we try and release certain guidelines that the insurance companies release or any trends that we see. If we're seeing, I don't know, 5 to 10% decrease, for example, from a certain payer, we'll make sure that our clients are aware of that change. Especially for out of network, you don't really see that granular scale on the in-network side of things. If anything, they're continuing to rise. But we stay in constant communications with our providers just to make sure that they can have the best knowledge available to them so they can continue running their business, because we have some providers or actual small businesses that are affected by a change like that. That's 5 to 10%. So it's always good to know what a trend looks like or a mistake looks like, right? If we see a mistake that the insurance company made, that's easily fixable. If we see a trend that it's happening multiple times, it's not fixable, right? Then we have to do something about that and pivot.
I think that's a tremendous value add because, when you look at all the medical billing companies out there, everyone's trying to be different. But the fact that you're offering this piece of technology or this advanced notice, I think is a tremendous value add and a major differentiator from anyone else. So good for you for trying to find it. Um, and you live in California, one of the most, your office is beautiful. It's just so, I love just watching this journey that you're on. It's a beautiful thing. I also love watching like young entrepreneurs because I do feel you starting at such a young age, you're going to be doing this for a long time because it seems like entrepreneurship is in your blood. It's your passion. So it's really cool to see that.
Thank you.
Okay. Any final thoughts? Anything that I didn't ask you that you'd want to share with our listeners?
Ooh, honestly, no. I mean, I know there's a lot to go over. Medical billing is can be a challenge. For me, it's fun. It's interesting. It's something new that we deal with every day. It's a new battle. My biggest thing is I love advocating for our clients, not only our clients but the patients in the facilities. Right. Again, they don't necessarily know who we are, but we take our job seriously. We love to do it. We love to figure out new innovative ways to be able to not only help the clients, the patients, but our employees here as well. So it's a full cycle, I should say, of the enjoyment that I really do get out of this job. Um, we have a lot of innovative things that are going to be releasing soon. So if anyone has any questions that's watching this or listening to this, feel free to reach out.
Talking about reaching out, tell us where people can find you on social
Yes.
media.
So we are on LinkedIn. You can find me on there, Abdul Ahmed. Also, our business site, CA Billing. Again, all my contact information is on there. If you guys have questions, want to message me, email me, call me, feel free to do so.
Awesome. This was Abdul. This was just a true pleasure chatting with you as always. I'm wishing you tremendous success and I'm excited to watch you on this journey. So thank you so much for joining us today.
Likewise. Thank you so much for having me. It was a blast. I appreciate it.
Thank you so much for listening. For more episodes and takeaways, visit leadersinmedicalbilling.com. This show is sponsored by 4D Global, empowering medical billing companies to grow through offshore staffing. Visit them at 4dglobalinc.com.